Sometimes it's anxiety about the vaccine, but sometimes actually people are okay about the vaccine, but they really had a bad experience in the clinic and don't want to go back there, or they don't trust the government for reasons unrelated to the vaccine. For instance, the MMR saga with Andrew Wakefield in 1998, which started here in the UK. They were just coming out of what they called the mad cow scandal.
John Gummer is convinced that beef and beef burgers are safe to eat, and is prepared not just to eat one himself, but to feed one to his daughter to illustrate the point.
So the public had lost a lot of trust in the government's transparency in a previous episode that had nothing to do with the vaccine. But when the suggestion of MMR and autism came up, and the government said, don't worry, it's not a problem, this is misstated, the public goes, wait a minute, why should we trust you? You also told us that, don't worry about the beef. And in fact, we needed to. Communities have histories, individuals have histories, and we need to take those into account.
So what's at stake in not trusting it is continued disproportionate hospitalization and death. It's an initiative funded through the NIH to address COVID in minority and underserved communities, specifically focusing on education, information or misinformation, readiness for treatment and vaccine uptake. One of the major problems for minority communities in particular is mistrust in the medical institution. And that mistrust is grounded in historic and contemporary mistreatment. They're mistrustful because of what our country's done to them. The number one concern is side effects. Number two is, can we trust that the vaccine is being prepared to do what it's supposed to do? Or is this a facade for some covert purpose? It's just a matter of trying to provide information and then hopefully redirect them to other individuals or resources that they feel they may be more comfortable hearing it from, other than myself or my colleagues at the university.
One example we're doing here of many is we developed a new digital online tool where we try to collect information from different digital platforms, and through machine learning and algorithm, we try to identify narratives that are rising. What are the hot topics people are discussing and what could be a problem, including catching on misinformation, but actually what are people interested in terms of narratives, but also in terms of what are the questions they are asking. When we have a tsunami of information, it's hard for people to find the right information at the right time that can help them to take a healthy choice decision. And when you have too much information, they don't find it. And with this comes also mis and disinformation.
everyone.
Hi, everybody.
Hi.
Hi, guys.
Quando tiver uma vacina disponível para ser humano contra o coronavírus, o que é que você vai fazer?
They'll answer questions. People ask them questions and they answer them. They also give little bits, and they also you get to know them as people too. And it kind of humanizes the science, but gets you the good science.
What exactly is RNA?
Humans have eradicated smallpox, and hopefully with the coronavirus vaccine we can stop this pandemic in its tracks.